Hi guys, my name is Ali Severino with Addiction Helpline America. Addiction Helpline America is an easy to use and navigate online directory for addiction treatment resources. It helps you find addiction treatment resources all across the country in all 50 states. If you or a loved one are looking for any resources, please visit addictionhelplineamerica.com, scroll through the site, pick your state, and find all the resources near you. Today we're going to talk about the different levels of care that are offered through addiction treatment services. These levels of care include detox, inpatient residential treatment, partial hospitalization programs, also known as PHP, intensive outpatient programs, also known as IOP, as well as regular outpatient. We're going to go through all of these, talk about some of the benefits, talk about the differences, and help you figure out what level of care might be best suited for you and your needs. Let's get into it. The first level of care we're going to talk about is the most common, and it is called detoxification. I'm sure you've all heard it before. Detox. Detox is usually the first step in the addiction treatment process because it's so important to get all those toxins out of your body. The detox process typically lasts about 7 to 10 days, but could last a little bit longer depending on certain people's circumstances. The detoxification process typically happens in a hospital-like setting where you have 24-hour care from nurses and doctors who are able to help you manage your withdrawal symptoms. These can be difficult to manage on your own, so it's great to do it in a hospital setting with medical staff that's there and trained and prepared for these withdrawal symptoms to happen, and they know how to make you feel better. Depending on what you're using, there are a wide range of withdrawal symptoms that vary from nausea, muscle spasms, diarrhea, vomiting, muscle pains, muscle aches, weakness, fever, hallucinations, agitation, depression, anxiety, insomnia, inability to eat, inability to hold food down. Depending on how severe your addiction is, your withdrawals are going to vary. While you're there, you're going to be able to get medication, medical attention, and therapeutic needs met. While we're talking about the detox setting, I just wanted to show you guys a detox. This is Future Now Detox, and I know we keep saying a hospital setting, but as you can see, it's a lot more comfy than that. Places to lounge, watch TV, sleep, eat, rest, and get better. So just wanted to show you guys what a detox looks like. Towards the end of the detox, you'll talk to your case manager or your therapist about the next step that's best for you. So you've finished detox, and now you have to figure out what is next. The next level of cares that we're going to break down for you are going to be residential or inpatient treatment, PHP, also known as partial hospitalization programs, IOP, also known as intensive outpatient programs, and Opie, which is an outpatient program. So residential treatment is basically a 24-hour, well-structured level of care where you reside, where you seek treatment. So you are not going home at the end of the day. You are staying in this facility. You are living there. You are eating there. You are playing games there. So like I showed you guys a detox, I wanted to show you what an inpatient residential treatment facility looks like. This is a place in Colorado. It's 64,000 square feet, and basically every single thing that you need is inside of it. So I know kind of you think, oh, I'm in a facility 24 hours a day. I feel like that would be really uncomfortable. But as you see, they have an on-site pharmacist. They have all different group rooms for different activities, therapists, places to eat, places to hang out outside. You'll have your own living quarters, places to do your laundry, places to get your hair cut. They usually have little workout areas and gyms inside these residential treatment facilities. So I just thought it was a really good example to show you guys of, maybe you won't expect something exactly like this, but they're all pretty similar. You see this girl putting her stuff away. They're hanging out with little doggo throughout the day. I just thought it was really great because this really does show a good example of what an inpatient residential treatment facility could look like. Residential treatment is the highest level of care possible after detox. Throughout the day, you'll have a ton of groups. There are different kinds of residential treatment. So short-term residential treatment is usually about 1 to 6 weeks. Long-term can be all the way up to a year. There are also things called therapeutic communities. A therapeutic community, it's super cool. The clients and the providers, like the therapists, they all live together on the same compound. So it's 24-hour care, it's structured care, and it's also long-term. And many of these therapeutic communities are focused on co-occurring disorders, like addiction and depression, or addiction and anxiety, or eating disorders, etc. While residential treatment facilities are awesome and the care that you get there is consistent and structured, some people can't go to residential treatment programs, so they'll opt for a lower level of care. Sometimes even your provider will suggest a lower level of care if they think it's best for you. So now we've gone detox, residential inpatient treatment, Right below that is PHP, also known as partial hospitalization programs. When you are in a PHP program, you are spending 20 hours a week in a facility. Being that PHP is a lower level of care, you do not actually have to live in the facility 24 hours a day. You can possibly live in a sober living house, or you can even live in your own house. And basically, you're going to go to attend this program 20 hours a week. The therapy is very similar to inpatient. It's just not the 24-hour care aspect. When you do go home, you are on your own. But this also allows some perks and benefits. The benefits of PHP programs are really the freedom. This might be good for somebody who has a child at home or has a job, because you're able to continue your life while still attending a treatment program. You're going to do different groups like 12-step programs, process groups, art therapy, relapse prevention, stress management, anger management groups, and more. A person will usually stay in a PHP program for about 30 days, or until your provider feels that you are ready to step down to the next level of care. The next level of care down would be IOP. IOP is intensive outpatient. Basically what intensive outpatient is, it's a step down from PHP. So PHP, you're there 20 hours a week. IOP, you are at the facility for 9 hours a week, going to therapy, doing groups, doing process groups, anger management, all that good stuff. Just like PHP and IOP, you are not living at the facility. You are either living at home or a sober living environment. Again, this could work really well for someone who has a job, has kids, or for some reason cannot go to a residential treatment program for a week or a month or 6 months. So these are definitely lower levels of care that work and are effective for the right client. And all of these levels of care include drug testing, which is so important. After you're done with IOP, which you could be in for 3 months or longer, you drop down to OP. And what is OP? OP is just regular old outpatient. So now instead of going 3 times a week for 9 hours, you might go 1 time a week for 3 hours. And it's really nice to have these levels drop like this because you can continue to get the care that you need. When you're at PHP, you might get to a point in your recovery where you don't need to go to a treatment facility 20 hours a week. That is the hope after all. So after you have gone down the entire spectrum of treatment levels from detox to residential to PHP, IOP, and OP, what's next? You can continue on an outpatient level of care usually for a pretty long time. It's only 1 time a week. This can even be lowered to every other week and once a month, depending how far along you get in your outpatient process. You can usually stay in outpatient for a good amount of time, but also you're just checking into a facility and you're living at home and you are working or going to school or raising your family or whatever it is that you do. At the end of the day, guys, there's no one size fits all in recovery. That's why it's so important to know all the different levels of care that are available to you. Some of you might feel that a therapeutic community will be the most effective for you and your personality. Others might feel that for their circumstances, they prefer an IOP level of care. Remember, detox, hospital setting, 7 to 10 days. Residential, total inpatient setting, and this can last 30 days typically, but could last up to 3 months, 6 months, or a year, depending if it's short or long-term residential program. You have therapeutic communities, which usually are long-term as well. Below that, you have PHP or partial hospitalization programs, which are 20 hours a week at a rehab facility. The rest of the time, you are either living at home or in a sober living house. Below that is IOP or intensive outpatient programs, and that is 9 hours a week at a treatment facility, and the rest of the time you are living at home or in a sober living environment. After that, you have OP, which is just once a week for 3 hours. You go see your therapist. Our website, addictionhelplineamerica.com, lays out every single level of care and goes even more in depth than I did into what to expect when you're going to each and every one of these levels of care. So if you want to know more, go to our website, addictionhelplineamerica.com. I hope that you guys get all the information that you need, and I hope that you have a fantastic day. Please like, share, and subscribe for more videos, and if you want a video on something specific, please comment down below. You guys are the best. I hope you're having a great day, and I will talk to you soon. Bye.